I'm really delighted to be invited to be part of the very important work of STARTS, an organisation that has been on my radar my whole career, and I always hear such great things about service delivery, the quality of services, and of course the passion of the staff. So I'm really delighted to make what I hope is a small contribution today to your work, and I know that there's a lot of people who will be joining this seminar who are already seeing families, who are thinking about seeing families, maybe wondering if this is a career change for you or another opportunity for you to broaden out your therapeutic work. So in having a large number of people involved, what I've tried to do is be fairly straightforward in the principles that I'm trying to talk about. So some of you might find that a bit basic. Some of you who are new to the work hopefully get a flavour for what I would like to introduce to you. And then for those of you who would like to push things further, I really welcome the conversation and the questions so that you can get your needs met as best we can in this format. So just to start us off, I just wanted to note that often the way our services are funded absolutely directs our work, and mental health service delivery in particular can very much focus on individuals, so that even if you're funded to do some family work, or there's permission within the funding or your contracts to do family work, that somehow it can feel ill-fitting, hard to organise. It can be trickier to engineer everybody to come. Maybe the architecture of your space doesn't allow it to be an easy setup. Maybe the hours of your service delivery doesn't even enable people to come because they'd have to get out of school and work. There's lots of things that get in the way, and in fact it can be tempting to just reduce our services down to sort of the simplest unit. Well, I can see individuals, I'm trained to see individuals, my service is funded to see individuals, so I'll just do that. And you can become obviously very good at that. And the thing is that a lot of our training, particularly in counselling, is looking for the individual suffering that people experience, the symptoms that they're displaying, the impairment they may feel that they have, the worries on their mind. And we want to tune into their world, understand their experience in the way that they see their experience, and that already gives us a lot to do. So even thinking about other people can feel like it's just adding elements that make things even more complex. And yet what we know is that we are all relational beings, that our life experience is always experienced in context to others, whether it's the people we live with, the people we work with, the people in the communities we live, the flatmates we have. There's ways in which we are always relating to others, and we experience life's journey with others. So to start to think about the internal world of someone, that yes, that's important, but starting to think about all of our experiences in relational ways opens up new opportunities that I hope that we'll be able to talk about today. And it's important too that our services are impactful. So we need to really think about what is the fastest, most effective way that we can help people to get on with their lives. And I think that's something that we need to hold ourselves to account about. If I could really offer the person in front of me the best possible experience, a strengths-based experience where they could get some ideas and be kind of off and running, what would that look like? So I'll come back to that. So even though people might come in individually, and you always have one member of a care system, say a family, who is the person who makes the call. So that person is the person who is holding up the red flag. Myself or we have an issue, and I'm ringing to book in some way. So behind that individual, because they may not be the person of concern, they may be ringing on behalf of somebody else, or they may be the first person who noticed that there's an issue. They will start to explore what the service offers, and then how they see the world and how we see the world will direct everything from here. So if they say, I have a problem, and we're in a service that sees individuals, then we will say, come in and talk to me about you. And already we have started to think about that experience in a particular way. But there is no life experience, as I've said, that isn't a shared experience in some ways, whether it's joyous or not so joyous. And so what you sometimes find is the person who rings up may be the person most suffering, but they equally could be the person who's least suffering but most worried, or least suffering but has the most capacity to make a call. And so you don't really know from the beginning what you might be dealing with. And so I think just starting to explore what is the request and what is the best way to meet it, that intake moment is in itself often quite illuminating and an opportunity for us to maximise. The other thing to think about is that people will often present their children for assistance, not only because they're worried about their children, and it could be true enough that it's children that display more of the symptoms in some ways, but also I think for people who are reticent to get help, they will bring their children forward and it's okay for a parent to be worried about their children. So I'm not saying they do that deliberately or consciously, but sometimes children are presented when in fact they're just the sort of tip of the iceberg. And I do remember many years ago seeing a family and I saw them all together, and they brought along a tiny child about 3 years old, and I asked, you know, who fights the most in this family? And it was the 3-year-old who said, Mum and Dad, very disclosing about what else was going on. Of course, they had brought the child in because they were most worried about her tantrums. So to think about the family as having information, how the problem is conceptualised, is only one part of the story. So as I've said, we have to bear in mind that there may be other people in the system who are also really concerned. And what we know is in mental health service delivery that only 1 in 5 will reach out and probably be able to access support. So there are a lot of people that move in and out of mental health concerns who may never seek help. Now, if we think about this in terms of suffering, that what we know is that people have different defence mechanisms and coping strategies, and some are more socially acceptable than others. So, for example, someone who is really distressed but buries themselves in their work, they might get staff awards, they might get promoted, they might get a lot of accolades that provide reinforcement for that coping mechanism. Somebody else who can't even make it into work because they're so distressed looks like a big problem, you know, a drain for the family, someone who's not thriving, someone who is of concern. And of course it is of concern, but they can be different ways of showing the same distress. So I think it's worth us looking at, even when we hear about one person in a family, who is directly behind them. We know that carers are at great risk of mental health concerns themselves. So leaving them out of the equation isn't necessarily in their interests or the interests of the person most suffering. So I'll just introduce you to a very a simple formulation of a problem. So again, many of you will think, well, this doesn't even touch the sides in terms of some of the things that you're working with. So just to suggest, though, to bring this alive, a 46-year-old woman named Shari came in for assistance with counselling. So she was very worried about how to help her son, 16-year-old Eli, who was school refusing, staying at home, locked in his room, not wanting to come out, not coming out for meals, being rude and defiant with family, not doing any of his schoolwork, not participating in any sort of household chores. They had a younger daughter who was well settled into school and seemed to have friends. This was a family who are a refugee family who came from a war-torn country. The parents are both employed, working very long hours, but not in their areas of professional specialisation. They're underemployed in that sense, is such a common story. And the parents are very worried about Eli, that he is not thriving at all, and he has said that he feels the teachers don't understand him, he's not engaged in class, and he feels bullied at school. Shari also said, well, his dad and I also feel discriminated against and unhappy at work, but we know we have to go, and we need Eli to go to school, and we need someone to help us get Eli complying with the school rules and the family rules. So this is a very common presentation from a parent who is very concerned but has come in on their own saying, I need parenting assistance. So let's just think about that for a moment. What you could think about is, okay, she's asking for parenting tips. So we could go into, so what have you tried to get him out of his room? What have you tried to get him to school? Have you explained that it's compulsory in Australia? What's the discipline like? What are the consequences for his behaviour? You could send her to a parenting course. If you just directly accept the request as it is, then that is definitely one way to look at it, and she might find that very helpful and very resourcing. But you could also consider that maybe Shari is the whistleblower for the family, that she's looking for ideas. She's definitely stuck and looking for ideas. But as you talk to her, what you know full well is that she and other family members have an experience of suffering that's not in the presenting problem. The presenting problem is the three of us are getting on with their lives, but Eli is absolutely not. He's not compliant, he's not fitting in, he's the odd person out. And we could also start to think, oh, well, Eli's behaving like an adolescent boy. Maybe this is about being a boy. Maybe this is just about being a bit bolshy at this age. Gee, I know lots of boys that are like that. She might have also talked to other parents who are saying things like, oh, well, boys will be boys. Yeah, they're all a bit difficult at that age. And what that can tend to do is grab at straws. You know, is it a discipline issue? Is it a boy issue? Is it a 16-year-old issue? Is it a school issue? But what it doesn't do is maybe give any particular context for what we might be dealing with. So when you think about the interview, you might ask Shari a whole lot of questions. You know, well, why did you come to see me? What's the main problem as you see it? You might ask about living arrangements, who's at home, those sorts of things. You know, when did this start? You know, and what does he say is the problem? You might look at how everybody else is settled in and thriving. You might see if they've spoken to the school, those sorts of things, and what they've tried. Now, these are all the very understandable first session questions, and they're all very useful. I think the challenge here is that we don't often make any use of the answers to these questions very much. So we may collect data, and for many of us who then have to fill in a data system after the interview, we're very glad to find out who's in the family and who's at home and those sorts of things, their ages and stages and their cultural background. But do we actually start to think of, well, how is this perhaps, what is this like for Eli to live at home? What is his experience of his world? Do we take his perspective? Do we start to think about, I wonder why Shari's here and nobody else? Where's the dad in all of this? Do we start to think in relational ways about the problem as it's described? Or do we move to keep servicing Shari in that more linear way? And do we actually record the data but think, oh, well, the others aren't here, so they're out of the story? She might say, oh, Dad's at work and he's too busy to come, and I didn't need to bring my daughter because she's not part of this. And as busy clinicians, we can think, okay, good, that neatens everything up. Not because we're trying to be sloppy or unhelpful, but you know, we are working under pressure and we are working with the person who's turned up, and sometimes that's we get stuck in that view. Whereas thinking systemically means that we need to see the individual within their family or their care system. We can't see an individual's behaviour as separate to it. Now, this doesn't mean we're not just looking to pathologise Eli, we're looking to pathologise the whole family. You know, have the parents lost control? You know, is there poor discipline? That's because we're not, in a family systems lens, we're not looking for trouble, we're not looking for pathology or diagnosis. What we're looking for is contextual understanding. How is it that this problem could arise? I wonder what it means that this problem has taken this form in the family. And in this lens, you might ask something about Shari's own relational experience. How were you at 16? What was it like for you growing up? If Shari says, well, I was always the good girl, that might really provide illumination that as a mum, she finds it pretty tough to have a son who's not a good boy. Maybe she was a rebel growing up, and she has a lot of understanding for Eli, understanding her relational experience and what she brings to this, how she thinks about herself as part of the parental system. How do you and your husband work together when a problem arises in the family? What's that relationship like? What's the quality of that relationship like? What does that say about the climate in the family? So starting to get a feel for the family unit, starting to get a sense of this is really important. And still saying, I wonder why it is that Shari is here. Why is this her role? We could say, well, of course, that's the role mums often play, but that shuts down our curiosity rather than opens it up. So in terms of looking at systemic principles, there's some really pivotal underpinnings of how we think about working with family systems. And so one of the cornerstones is really, as I've said, that problems or symptoms are very much understood in their context. How is it that this behaviour has come about? How do we understand it in the relational forms in the family? What communication is in Eli's behaviour? Who is he communicating with? What we do know is that he is distressed, and he is showing his family that he is very distressed. And yes, his non-compliance might be very difficult. Certainly makes it harder for working parents that the kids don't just get up and go to school. But he is communicating something important to the family about his distress. Rarely is the way people tell stories the only way to understand it. Often you'll find a client has a very narrow definition of a problem. They'll say, well, it all started when he turned 16, or it all started in year 10. And suddenly you have a beginning and an end. That's very limited and time bound. And what happens then is we don't hear enough of the broader environment in which this started. Very rarely are things time bound. So often when someone says, well, it all started when he turned 16, you want to hear the story of 15, 14, 13 and 12. You want to understand the origins and how the family has been up until that point. So to say we're not looking for pathology, what is the matter with Eli? What do we understand about Eli? How do we relate to him? How do we stand in his shoes when he is not in the room? Also, people tend to do more of the same. We all do this. When we feel stuck, sometimes we can accidentally double down on the same behaviour. So that's why parents often come in and say, how do we discipline him differently, or how do we have better consequences to get him moving? And what you find is everything they've tried is consequence bound. I'm sure will have worked with families who've taken every single thing off the children as a form of punishment. I recently saw a family who'd even taken the door off the child's room because they were so stuck. They'd taken away every device, TV, dessert, time out with friends. And the thing is, they had doubled down to such a degree they'd got themselves in a complete corner because there was nothing else to take. And they were in a standoff with their young person. So if Shari came in and said, I need more parenting tips, and you armed her up with more parenting tips and she came on even stronger with Eli, there's no evidence that that would actually advance anything. So we already need to hear the history of what's been tried, which is also people's relationship to what they tried, people's relationship to help. Who else have they asked? What advice did they get? And when people are stressed, they do limit their creativity. They tend to shut down. They get locked into the problem. They don't see other family strengths. They don't see what else might be going well. They may not even see anymore how Eli does some things well, where things are going better for him, or even what his great characteristics are, because they get locked into their worry. And we need to start to think about what might this family have in common, because at the moment the story is, well, Eli is the odd man out. The three of the rest of us are getting on with their lives. So what are we thinking about what they've got in common? So here we are back at the individual interview, and we've started to move into, even with one person in the room, rather than what's the problem, tell me about your family and what's happening for you all right now. And so even if they've collapsed, Shari collapses straight into, well, Eli's in his room and he won't come out, that we start to look at how do you all relate to this problem? Who's most affected by it? Who's most upset by it? Who's engaged by it? Who's most involved with Eli around it? Who would most understand Eli's experience? Who can best stand in Eli's shoes? Who's he closest to in this family? Who else might be struggling even though they show it differently? And are there other concerns in the family? So once someone has said, well, Eli this and Eli that, it might be, are you worried about anything else in the family? Is anything else going on? What else is the concern? What else might need to change? And to ask Shari, what's made it that you're here alone? And what would you most hope would happen from here? So you're not immediately accepting the terms of the problem. You're trying to open up the space to think more broadly, because by the time the interview is done, you may have a whole variety of other resources, and how you sum up might be very different. You might be able to shed a different light on this with Shari, because you're not just working in me and Eli from Shari's perspective. It's now suddenly an open space. What else is in the family? What else is in the community? It's also looking at the roles people play. So in this process, you might discover that Shari and her husband are also really sad, resentful and disappointed at their work roles. But what they've decided is just be quiet, keep your head down and focus on the future. And that appears to be working for them in that they can get to work. Is it working for them really? Is it? How worried is Shari? How depressed is she? Is Eli's dad really thriving with this mindset? We don't know. All we know is it gets him to work, so he might say, I'm doing fine, at least I'm going to work. Eli's not even getting to school. But we can see that this family has a common migration experience, a common war experience, and they have arrived, and they are, again, another very non-pathologizing principle is this is a family that's doing the best they can. How are they making this work? We would also see that Shari is very lonely with the problem. In fact, the only client you've got at this point is Shari. She's presenting Eli, but Shari is the one in the room. And she's the one who's lonely. She feels really responsible. She might, she might have a husband who's saying, well, you go and fix the problem. She may well be suffering herself, feeling very sad for Eli, and just doesn't know how to manage this. So, in terms of a different lens, starting to think about this, we move from an idea that Eli has a problem. He's the one acting out and the only one with a problem. It started when he was 16. Other boys wouldn't be like this. Shari perhaps saying, my parenting's on the line. I'm really embarrassed by this. I feel like a failure as a parent. There's a very, what we call a thin description, a very problem-saturated, negative description. Whereas what you might say back, it seems to me that your whole family understands suffering, but you're scared about talking about it. You worry that if you open that up, maybe all the great ways your family is getting on with its life will collapse if you bring the past into the present. That Eli's behaviour, even though it's really difficult for you, he's showing you that he's struggling, and that makes sense because there's a lot to struggle with. That it doesn't work for him to be silent. What he needs is some communication around this, and he is communicating with you through his behaviour. He's letting you know that he's really struggling, and it's not as easy for him to just go to work, even though as parents you would think, what a great plan, just get on with your life. We also need to know, is the family itself very isolated? And the more that they're embarrassed perhaps by their son's behaviour, maybe they've withdrawn from other community members because they think, well, everyone else seems to be better parents than us, so we're ashamed, and that makes them more isolated. So where we end up then is thinking about the whole family in an affirming way, that you're making it, you're working very hard to make this work, that Eli is finding this really difficult, and that doubling down on some of the strategies, seeing it as only an issue of discipline, might also just lead you to the wrong conclusion. It's understandable, being a good parent, that you're trying very hard to get him moving, but in fact that's really hard. But you also turn your attention to Shari, which is, you seem very isolated with this, and that in fact you and Eli having a lot in common, because he's in his room not knowing how to thrive in this circumstance, and you're here in my room trying to work out how to be a good parent. So what we know is you and Eli, at the very least, know something about worry, and you've got that in common, and maybe you understand that. And how do we know that maybe the daughter doesn't have some worries? Can you imagine if you were the daughter who looks like she's skipping through life? If the daughter had a worry, would she dare tell a family where Eli's already a big preoccupation for her parents, and her parents are probably already rather sad and not enjoying their lives? Maybe the daughter's only role is to be the joyous one. And this is often what we see in families. An individual can get stuck with the role and they're not able to get themselves out of it. So what we might recommend at the end of this is to say to Shari that she has a lot of concerns, and that a family discussion could be really helpful. And she may say they won't come in, but she also might say, okay, I'll see if that will happen. So what we're ending up with is that we're acknowledging that the whole family is working hard, but they've got different solutions, and that a common conversation is a way to build bridges rather than sending everyone to their corner. So just noting about, the trauma context, that obviously people suffer in very different ways. And as I said at the beginning, there are very different defences and coping strategies, and some in society are more functional. We often talk about a functional alcoholic, who is the person who drinks but still might make it to work, still get promotions, but behind the scenes is really struggling. We know that some people actually work hard to overcome great anxiety and depression because they are determined, maybe through their own family stories, to keep participating, but it is like dragging a bag of rocks behind them all the time. And we do find that families have common experiences, but they might splinter in terms of how they manage together. Thinking about how an individual can intervene in their family system is also quite creative. So for me, because I know that people often come on their own, I am always thinking about that person as the family representative. I don't see them as an individual in that way. I see them as exploring something in a web of relationships. And so I want to talk to them about, how is this working for you? Where do you feel like you can most help your family? Where do you get stuck? Maybe you get stuck because you can't do it alone. It's not only what you've tried and really affirming those strategies, but what are the ways that in fact people can step in compassionately to talk about the things that are unspeakable at this stage, and maybe some coaching around that might be a way to soften the family dynamic and invite people out from their corners into a different experience. But ideally what people would do is come and talk to us as a group. So I just want to say something about the value of that. So generally, if we were to do more family sessions, the literature says that family work tends to be shorter. So thinking about services being impactful, value for money, all the things that as leaders we have to think about. Family therapy, because you've got everyone in the one room, it tends to be faster, more impactful work because everybody who needs to be discussing it is there with you. And so therefore it's more cost effective, but it's because you're preventing other things that might be happening down the track. For many of you that see individuals, and I see many individuals too, often you will have someone saying, yeah, I really need to talk to my mother about this. And then the next session they come in, did you talk to your mother? No, it wasn't the right time. I wasn't able to do it. And you find weeks pass where you're coaching, and whereas if everyone's in the room, that conversation just happens. You also find that the family builds collective memory. So if someone in the room goes back into their old bad habit, other family members will call them out and say, remember that session we all committed to doing something differently? It means that there is more collective memory and a way of actually moving forward with agreements or solutions that you've come up with in the session. So I think these are the ways in which we are preventing problems from emerging in the future. We also need to remember, I might just, perhaps it's a bit repetitive, I might just move on because I know our time is short. It's also to remember that a family system sits within a web of other systems, whether it's a school system, a work system, a community system. So when we are talking to families about their experience, we absolutely have to take that into account. If a family member is being bullied at work or bullied at school, that not only reverberates through that individual, but it reverberates through the whole family. A whole family can become paralysed by the pathology of one member, and can feel, they circle around that person and can feel very ground down and distressed. So I think we've also got to take into account how the family can resiliently work with the other systems that they need to move in and out of. That's a subject of another whole session about doing that. But I think it's also remembering that in our own work we mustn't become isolated, that sometimes I'm supervising therapists who've got into a mindset that what I do with this individual or this family is where all change happens. And that is such a mistake. We've got to remember that we are but one cog in a much bigger service system. We can bring a lot of resources to this, the person presenting, but we need to always work with other systems and help the family work artfully with other systems as well. So what this means for us in terms of professional development is that we need to move from that individual focus to a broader systems lens, and that actually takes professional time. And often it means that as a service system, if you go off to a family therapy workshop and you go back to your individually focused service, you need colleagues that bring this alive. You need workshops, professional development, and some people will go as far as a graduate diploma or a master's in family work who really want to immerse themselves in relational thinking and relational intervention. But even doing some shorter courses are more bang for buck if you can go with other colleagues, so that you can really encourage each other to think about some things in new ways, keep the discipline going. Because again, we are part of service systems, and how we relate to our organisations and our teams, we are also relational beings. And so we need that service change, that service lens, also supported by systemically trained supervision, so that the ideas keep percolating and flowing throughout the system. So I will pause there. That is the whistle-stop tour of some family-focused ideas. But I would really welcome your feedback and questions to see how this fits your work and take the conversation forward.